Hi, welcome everyone. Thank you so much for coming out tonight. The information that I'm going to be sharing with you today is so important and so amazing that I think you all did a really good job deciding to come here. So for anybody that I haven't met yet, I'm Dr. Corey Stern. This is my office, and I want to tell you a little bit about myself and why I am delivering this information to you, even though I just finished seeing 30 patients and I'm a little bit tired and my feet hurt and I'm hungry. But I'm not saying that because I want you to feel sorry for me. Just giving you an idea of how important this information is to me and why I'm so passionate about it. So I'm going to start my story. In my childhood, I was sick all the time. I was always on antibiotics. I always had a throat infection, an ear infection, or a bladder infection. And by the time I was 15, I had a throat infection that would not go away. And my parents just kept bringing me to the medical doctor, and I kept getting put on different antibiotics, and it wasn't getting better, and I was getting really upset because it was summertime and I really felt sick. I couldn't even get out of bed, and I wanted to be able to go hang out with my friends. So I decided when I was 15 that medical doctors don't know how to help you with your health, and that I was going to try to figure it out myself. So I started to do some reading, and this was back in the olden days in the 1970s where they had these things called books. Anybody remember them? Yeah, okay. So I have some people that are my age in the audience. Okay, good. So I was reading different books, and one of the magazines that we had in the house at the time was something called Prevention. Have you heard of that one? Yeah, so that was like an alternative health magazine, the only one really of its kind at the time. And when I started to read that magazine, I suddenly realized that there was a connection between what you eat and your health. And boom, I finally understood why I was sick and I could not get better. I had a really bad diet. I was mostly only eating sugar and fast food and junk food, and my mom didn't really cook very much. She would bring home McDonald's or Burger King or Kentucky Fried Chicken, and I was eating tons and tons of cookies and candy and cake and ice cream and soda. It's mostly all I ate. So I decided to completely change my own diet. I was working as a babysitter at the time, making $1 an hour, which was big money back in those days. And I spent all of my own money on food. And I completely eliminated sugar and white flour and preservatives and basically anything processed or junk or fast food. And guess what happened? My sore throat resolved, finally. So I continued eating that way for years. And at age 23, I gave birth to my son, who was born with a very rare condition, and he ended up needing a lot of surgeries, and he was in and out of the hospital a lot. And when I would be in the hospital with him, I'd be really nervous, and I wouldn't really eat very much. I was too nervous to eat. But when we would get home from the hospital, I would be starving because I hadn't eaten sometimes in 2 weeks. And I would start eating things that I knew from what I learned when I was 15 weren't good for me. So I might eat a whole pizza and a box of cookies. And I just couldn't control it anymore. I lost control. And after doing this, he was in and out of the hospital having many surgeries. And after doing this many, many times, I started to not feel well again. And the first thing that happened was I started to get throat infections, and I was getting throat infections every 60 days. You could tell the calendar by my throat. And then other things started to go wrong in my body. So I actually developed some pain, and the pain it started right here. So I thought it was my ovary. I thought it was a female issue. So I went to my gynecologist, and she examined me, and she told me that I had a cyst on my ovary, and she prescribed some birth control pills to shrink the cyst. She told me to come back in a few weeks. So I did everything she said, and I went back for my follow-up visit, and she said, okay, well that worked because the cyst is gone, And I said, yeah, but I still have the pain. And she said, oh, I don't know what's wrong with you then. And I said, okay, thank you. And I left there in pain. And time was passing, months were passing, and the pain was getting worse. The pain actually spread down my leg into my foot. I thought maybe it was my foot that was causing the problem. So I went to a podiatrist, a foot doctor, and he examined my foot and he said, oh, I think I see what the problem is. You have something called plantar fasciitis. Anybody ever hear of that?
Mm-hmm.
Yeah? It's inflammation of the tissues in the arch of your foot. So he prescribed me some anti-inflammatories and he made me some orthotics, inserts for my shoes. And I did everything he said and didn't help at all. Pain was still there. Now more months had passed, maybe by now a couple of years had passed, and the pain was actually getting worse, and it spread to my other leg and foot and then into my low back. So I thought maybe it was my back that was causing the problem. So my son was getting physical therapy. He had a therapist coming to the house, Louie, really nice guy, and I said to Louie, you know, I'm having low back pain that's going into my legs. Do you think you can help me? And Louie said, sure. So he does an evaluation and he says to me, oh, I think I see what the problem is. He said, you have very weak butt muscles. He said, that's why your butt is flat. And I said, what? Oh yeah, he was right. I never noticed that before. So it's not funny. So he gave me a bunch of exercises to do, and I did everything he said, and now I have buns of steel. Anyone want to check these babies out? Go ahead. Right?
Ooh.
Except for one problem. It didn't help me. I was still in pain. So now several years have passed, and this pain continues getting worse. It spreads up my back into my neck. I started getting headaches. I was not sleeping well. And then more things started going wrong. I started getting chronic urinary tract infections, chronic vaginal yeast infections. I was just like a complete and total mess, and I had pain all over my body. It was just getting worse and worse. And then one day I woke up and I felt like I had a fever, and I took my temperature and I had a low-grade fever, and I still had the fever the next day and the next day and the next day. Well, I had this fever every day for several weeks. So I started getting scared and thinking maybe I was dying. So I made an appointment with a medical doctor, even though when I was 15 I decided medical doctors don't know how to help you. I went to a medical doctor and he did extensive blood work, and he tested me for Lyme disease and rheumatoid arthritis and lupus, and he sent me for a CAT scan for all my internal organs. And when all the test results were in, he brought me back into the office and he said, well, got good news for you. There's nothing wrong with you. And I said, okay. And he said, I'm going to give you a referral to a psychiatrist. And I said, okay, because I didn't know what else to do at that point. So I go to the psychiatrist and he does this whole evaluation, and he says to me, I think I know what's wrong with you. He says, you have post-traumatic stress disorder from dealing with all of your son's surgeries. So he wrote me a prescription for an antidepressant and then one for a muscle relaxant and one for sleep. He gave me a sleeping pill, and he gave me an anti-anxiety medication, and he gave me some pain medication. So I left there and I started taking all these drugs, and I immediately could not function. I could not think. I could not work. I could not do anything. And I started to get severe sugar cravings. I started compulsively eating chocolate Chex Mix. Has anybody ever tried that?
Mm.
Don't go near it. It's evil. I gained 7 pounds in 2 weeks, and I felt horrible. And none of my symptoms were any better, so I said, you know what, I'm not doing this. I'd rather live with whatever the condition was than take these drugs, and I just stopped everything. And now here I am, that years and years have passed, and I'm in terrible shape, and I don't know what to do about it. And right about that time, I actually decided that I wanted to go to chiropractic school because I wanted to be able to help other people who were suffering like me. So I went to chiropractic school. My very first day, one of my teachers was describing a condition that sounded just like me, all of the symptoms I had, and he called this condition fibromyalgia. Anybody ever hear of that?
Oh, yeah.
Right? So I wasn't, I never heard of it before. It wasn't too popular back then. Right now it's really popular. They have TV commercials about drugs for it, but back then it was something new. So I ran up to the teacher after class and I said, I think I have that. And he asked me some questions and he did a quick exam on me. He goes, I think you're right. He said, good job diagnosing yourself. And I said, yes, I finally have an answer. I know what's wrong with me. So now what do I do? And he said, and I said, what do you mean? He said, we don't know what causes it and there's no cure. And I said, so there's nothing I can do? And he said, well, studies show exercise helps. And I said, yeah, but I'm already doing that. And he said, studies show magnesium malate helps. And I said, okay, I'll take that. So I went and got some magnesium malate. Didn't do a thing for me. So all through chiropractic school, I was doing research on fibromyalgia and looking for the cause and a cure. Didn't find out anything. Graduated, opened up my office here, and guess what the universe sent me? Lots and lots of patients just like me. And I didn't know how to help them any more than I could help myself. But I was determined to find solutions. That's why I became a chiropractor. I wasn't giving up. And I knew that nutrition played a key role based on what I had discovered when I was 15. I just couldn't connect the dots. I didn't know what I was missing. But I started to go to every nutrition seminar that was offered, and one of them was called nutrition response testing. And I didn't know what it was, but it had the word nutrition in it, so I went. And at that seminar, I discovered the missing link. And I got put on a nutrition response testing at that seminar, and within 2 weeks, I started to feel better. So all those years that had passed, it was 20 years by then that I tried what the gynecologist said and the podiatrist and the physical therapist and the psychiatrist, and nothing ever made a difference until I went on a nutrition response testing program. So I decided to devote my career to nutrition response testing and become a master nutrition response testing practitioner. I learned everything there was to learn. And I got so good at it that the people who taught me how to do it asked me to start teaching it to other doctors. So now I have the privilege of teaching many, many other doctors all over the United States. So today's topic is on stress. And some of you already know a lot about this topic, and some of you will know a lot more about it by the time you leave here today. Does anybody have anything specific they would like me to talk about? It can be anything. It doesn't have to be about stress.
Insomnia?
Insomnia. Okay, good. Thank you. Anyone else?
Can you talk about thyroid issues?
Thyroid, definitely. So many people are coming in with that. Anyone else? Anyone have headaches here? Okay.
Oh, yeah.
Yeah, all right. Headaches. All right. Anyone have a weight issue? Okay. Weight.
Cramps, PMS.
All right. PMS and cramps. Good. All right. So today I want to give you information that you can use right away for yourself and your family. Today we're going to explain to you the connection between nutrition and health. So the first thing I want to ask you about is this. Does anybody know what their body is made out of?
Water.
Okay, good. Water. Anyone else?
Cells.
Good. Oh, cells. Good. That's actually the answer I was looking for. So even water is made out of cells. So your whole body's made out of cells. Your brain's made out of brain cells. Everyone knows that, right? But everything's made out of cells. Your skin's made out of skin cells. Your heart's made out of heart cells. Your thyroid is made out of thyroid cells. Now, did you know that your cells are always dying? Everybody know that?
Really?
Okay, yeah. In fact, I think I see a dead cell right here. Just kidding. Okay, so if your cells are always dying, why are you still alive? Yep. Anybody? Because you're growing new ones. Cells are always dying. You're growing new cells every second of your life. Now, where does your body get the material that it needs to grow the new cells?
Probably what you eat.
Bingo! It comes from nutrition, from your food, from your water. Okay? Now, what does this mean? It means that if you're eating good food, you're growing good cells and your body is going to work well. But if you're eating bad food, your body is growing bad cells. And one or more things are going to go wrong. And what things can go wrong? You're going to have organs that are not functioning well. And it can be any organ. It could be your brain, your heart, your kidneys, your thyroid, your adrenal glands, anything can be affected. All right, now, let's talk about the difference between good and bad food. Here's my definition of good food. Good food is anything that grows on the ground, grows on a tree, or has a mother, and is minimally processed. So, what grows on the ground?
Carrots?
Okay, good, good. So vegetables, right? All right, good. What grows on trees?
Nuts?
Okay, good. Nuts and fruits. Good. And what has a mother? We're talking about meat. So, like cow, beef, chicken, fish, things like that. Eggs. Eggs have a mother. And you can even say dairy, right? Comes from a mother. And when we say minimally processed, what do I mean by that? We're talking about you don't alter the food too much. So cooking is a minimal process, sprouting, fermenting. Anything else turns the food into something we call a processed product. You alter the food so much that it no longer provides your body with the nutrition, with what we call the replacement parts that it needs to grow healthy new cells. So when you're eating a lot of processed products, you are going to be nutritionally deficient. You're not getting all the stuff that the body needs to grow healthy new cells. The other bad part about that is they're putting a lot of bad stuff in the food. They're putting toxins in the food. They're putting bad sugar. They're putting preservatives, all these chemicals. And now you're also getting toxic. Okay, so let's take a look at this board here. When you're eating a lot of processed food, you're going to have a nutritional deficiency. And when you have a nutritional deficiency, one or more of your organs is not going to function properly. And like we said before, it can be any organ. It can be your heart, your lungs, your liver, your stomach, your brain, your thyroid, your pituitary gland, any organ. And when your organ, one or more of your organs is not functioning properly, you are going to have symptoms. You're not going to feel well. And what kind of symptoms might you have? You can have any symptoms. You can have difficulty handling stress. You can get headaches, insomnia. You can have weight issues. You can have a low functioning thyroid or a hyperthyroid. You can have PMS symptoms and cramps. Other things can go wrong. You can get diabetes. You can get heart disease. You can get cancer. Those are all symptoms of organ dysfunction. And then what do most people do when they're not feeling well, when they're symptomatic, they don't have enough energy to get through the day? What do most people do? They eat something with sugar in it to help them be able to get through the day. But then when you do that, you actually cause more nutritional deficiency in the body and more organ dysfunction. So I just want to have you reach into your goodie bag right now and take out the pink piece of paper, which is called the sugar quiz. It's, are you a sugar addict? Okay, and I want you to fill that out and add up your falses. Okay, that's going to be your score. All right, so go ahead and do that for me now. And when you're done, just put your pen down so I know you're finished. All right, everybody got it? Did you find it? Okay, good. You have enough light in here? All right.
That's fine.
Okay, excellent. All right, just take a minute and do that now. And just put your pen down when you're finished. Don't forget to add up your false column. All right. Everybody got it? Finished? Are you finished? Did you add up your falses? Okay, good, good. All right. Who here had a score of 4 or more? Raise your hand. All right, well, congratulations. You guys are sugar addicts. Well done. Got to work on that, and I'll tell you why in a minute. Okay, for those of you that had a score of less than 4, do you ever eat commercial bread from the supermarket like Pepperidge Farm or Wonder or any of those brands? Guess what? They all have sugar added. How about breakfast cereal? How about ketchup? Anybody eat ketchup? Look at the label. Loaded with sugar. So if you're eating processed products, you are eating more sugar than you realize, even if you think you're trying to avoid it. So I erased everything here and I just put the word sugar, because sugar causes nutritional deficiency. Sugar actually interferes with your body's ability to take in nutrients. Sugar causes inflammation in your body. So sugar, when you eat sugar, you're causing a nutritional deficiency to occur. And when you have nutritional deficiencies, one or more of your organs is not going to function properly, and you're not going to feel good. And then when you don't feel good, you're reaching for some candy or some coffee with sugar in it or a donut or something like that, soda, to help you get through the day. And now you've caused yourself to feel worse, and you'll have sugar cravings and they'll get worse. And you will be stuck on this triangle. Anybody think they need to get off that triangle?
Oh, yeah.
Okay, good. Because really, what's going to happen if we don't change something? How long have you not been feeling well? What? 5 years? Okay. Yeah, so what's going to happen in 5 years from now? How do you think you're going to feel, right? So if you think you need to get off this triangle, I have good news for you. There's hope, because we know how to help you with this. So nutrition response testing is a tool that we use to find out exactly what's going on in your body and exactly what your body needs to fix it. When you use specific nutrition, you get specific results, and that's what we want. So the best way to explain how it works is to actually demonstrate it. So I'm going to ask, she doesn't know I'm doing this, but I have a very good patient attending this workshop. Donna, can you come up for a minute? Sure. Donna's been on a program with me for 2 years, and she's been getting great results, and we've been working on her thyroid. That's been the issue that we've been trying to help Donna with. So this is how nutrition response testing works. Everything in life has about 2 feet of energy emanating from it. Bodies have it, food has it, everything on this planet has this electromagnetic energy, and we're able to use that energy to get information about what's going on in the body. And the way that we do that is through something called a muscle test. So I'm going to push on Donna's arm, and I want you to just match my pressure. So she's really nice and strong. And now I'm going to contact her thyroid, and I'm going to annoy her thyroid a little bit. I'm going to put some pressure on it and irritate it a little bit. And now we're going to push on her arm again and match my pressure. And her arm is no longer strong. Everybody saw that, right? And you felt the difference, right? Okay, good. Now, to figure out what we need to do to help Donna's thyroid, I'm going to take a supplement that she's on for her thyroid, and I'm going to just put it near her body. And now we're going to go ahead and recheck the thyroid, and it's totally strong.